Which of the following is the most common cause of this patient's condition? So 35-year-old woman, 3-month history of weight loss, increased appetite, heat intolerance, and palpitations. Physical exam, tachycardia, fun tremors, and large thyroid. Laboratory shows decreased TSH and elevated free T4. Most common cause of this patient's condition. So picture is consistent with like hyperthyroidism, which but we have an enlarged thyroid gland, which makes me think almost like thyroiditis because, okay, adenoma would have like a specific.
So, so here going back to, so definitely for sure you kind of have zoned in on right? Hyperthyroidism, right?
Yeah.
So then the question is, right, there's a bunch of things that could cause hyperthyroidism, right? Which is kind of what they're testing you here. So you have Graves, toxic multinodular goiter, thyroid adenoma, right? I guess subacute thyroiditis, sure. Pituitary adenoma, unlikely, right? So
Yeah.
let's kind of just talk about these four, right? And so physical exam wise, what's the difference between if you were to give me a physical exam on a Graves person versus a toxic multinodular goiter versus subacute thyroiditis versus thyroid adenoma? Can you kind of tell me how the thyroid would feel?
Mm, the only one I can kind of associate a physical exam finding with is like the adenoma. You might feel something, but
Okay.
even then, it might be small enough you don't feel it. So,
Okay. Okay. So far, so good. Okay.
um,
So thyroid adenoma, is it one or multiple things you can feel if you can feel anything?
usually one.
Yeah, one, right? And an adenoma is singular. Okay. So how about a toxic multinodular goiter? What do you palpate when you what do you think you'll feel if you kind of, touch their neck and feel the thyroid?
I think it'd be like enlarged.
Okay, but be more descriptive. Is it just enlarged? Is it lumpy bumpy? Is it uniformly large? Is it
Lumpy bumpy.
yeah. So the physical exam of a toxic multinodular goiter is that you feel like, you feel a bunch of marbles and it's bigger, right? A goiter just means an enlarged thyroid, but multinodular meaning that you feel a bunch of nodules, right? Okay. And then how about, Graves' disease? What do you palpate? Like, do they have a goiter for Graves?
I don't think so.
So actually, Graves' disease does have goiter. And the way you remember goiter is this. This is how I remember goiter. A goiter happens when the thyroid is stimulated, right?
Mhm.
Either directly, right? Meaning, or how do I say this? Actually, let me rephrase this. A goiter happens when your thyroid gland is forced to produce a lot of thyroid hormone, T3, T4. Okay. It causes hyperplasia, right? And so because it's working overtime and the cells are working overtime to create more of T3, T4. So there's multiple things that can cause a goiter. So Graves' disease, what's the mechanism of why Graves' disease happens?
There's like an antibody against the
The
thyroid.
TSH, the
Yeah.
TSH receptor. Okay, so you're almost there, but yeah. So there's a TSH receptor IgG antibody that attaches there and then forces the thyroid to create a bunch of T3, T4. So when you have Graves' disease, you have a goiter, right? That is, uniformly, what I'm trying to say, a uniform goiter, right? It's not lumpy bumpy because the thyroid it's not multinodule. You get what I'm trying to say?
Yeah.
Okay, so I'm trying to get you the different physical exams. Okay, and last but not least, you have a subacute thyroiditis. So what kind of physical exam that is unique to a subacute thyroiditis?
Is there no goiter?
No, so subacute thyroiditis, the physical exam is that your thyroid is tender to palpation because it is actively inflamed.
Okay.
Okay, so that's going to be the key. So with kind of the physical exam, which one do you think is going to be your answer here?
Um, I think Graves.
Good, right? Because like we talked about before, right? They just say it's in a large thyroid gland. They don't mention that it's lumpy bumpy. They don't mention that it's tender, right? They don't mention that, you just feel one nodule, right? So the most likely answer here, based off of, it's hyperthyroidism and you have your physical exam, has to be Graves' disease because it's smooth but enlarged. You know what I'm trying to say? So that's kind of how you work through, this is how you work through kind of a hyperthyroidism question.
All right. Yeah, I'm sorry, I'm bad at these.
No, 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 that's okay. No, it's a, endocrine is kind of a lot of pathways, of course, and of course, I'm responsible for endocrine also in my field of ears, nose, and throat. So, you just over time, you just have to practice at it. You just have to practice. So, all right.